Hello, my name is Ricardo, and today I'm going to show you the MindCheck for Organizations product. So MindCheck is a digital platform empowering frictionless, holistic, and personalized mental health support for individuals and the enterprise. We have been around for a while, around 2 years. We help around 10,000 people every month deal with depression, anxiety, and stress. We have helped 160,000 people so far. And we aim to have to reach 1 million people helped by the end of 2021. So depression and anxiety and mental health problems in general are a huge problem in the world. They have been a problem for many, many decades. And with the coronavirus situation that happened now in 2020, they are even more prevalent. So these numbers are even before the pandemic hit. So you have here that 1 in 5 people experience a mental health condition every single year. So that's about 20% of everyone that you meet. You also have here that about 300 million people in the world suffering from depression. And also that depression is the leading cause of disability worldwide. So it's not a heart disease, it's not accidents, it is depression, the leading cause of disability in the world. Also, about 14 to 18% of the world's population is affected by anxiety disorders every year. That is only anxiety disorders. So you have depression, anxiety as the biggest mental health problems that affect the most people basically around the world. But these conditions, they are highly treatable. And most people don't know about it. They don't even know that they have it to begin with until they kind of figure out later. So the statistic is that only 35% of people who are suffering from anxiety or depression, they actually go out and seek and receive appropriate treatment. Many or most people actually live with that condition for years and do not seek help and do not find appropriate help there. So they are illnesses, they are considered illnesses, and they are treatable. So if people go and seek appropriate help and address the problem, they can get treated and they can get well. So as I said, the coronavirus situation is basically creating massive uncertainty, loneliness, job loss, and heightened sense of threat. And this is leading to an even bigger global mental health crisis, and even bigger global mental health pandemic, let's say, as well. So mental health does affect work in a big way. So depression and anxiety, it is affecting about 1/5 of most workers every single year. And this has a huge impact in companies' bottom line, as well as in the kind of living life and work satisfaction of the workers in organizations. So if these issues are not addressed, they do lead to lower productivity, like turnover at work, leads to disability, and potentially leads to suicide, which is a big problem. No one wants to have a case like that in your company. If they are addressed, they lead to higher productivity, higher quality of life, higher life and work satisfaction, and better overall health. So they're very important. They are addressed in the organization as well. So there is a report that Deloitte has prepared in the beginning of 2020 that really makes the case for investment in mental health initiatives, especially technology-facilitated early stage and screening-based mental health solutions, just like MindCheck. They have calculated the ROI of this type of solutions as at least 1,000% of return on investment there. Just in terms of lower absenteeism and presenteeism, more productivity, lower turnover costs, happier and more loyal employees, and better employer branding, general goodwill. There is even more to be earned there in terms of lives, better lives, and happier people there. So the cost of mental health, the same report, by the way, the report by Deloitte has calculated the cost of mental health problems at work at about 5.8% of the payroll every single year. The cost goes up if you have mostly young professionals, goes to about 8.3%. These are the costs of lower productivity alone. So let's say, for example, this is just an example, and we do have a calculator in mindcheck.me/orgs. So let's say you have a total number of employees of 200. and the average annual salary is 70,000. So, and they are of mixed age. They are not all mostly young. They are kind of mixed ages employees. The total, the expected annual cost, the hidden annual cost of mental health problems in the organization will be almost $1 million per year. So this is something that very few organizations realize, that it is mental health problems such as depression and anxiety are generating a massive loss, or basically a massive cost. They are hidden because of all the stigma, because of there's a very intimate issue for the worker to come out and open up. So they are basically hidden, and they are costing. So this needs to be addressed. And MindCheck can help address that. MindCheck was created for that purpose. So we created MindCheck for organizations exactly for that. With MindCheck for organizations, and I'll show you in a few minutes in details, but basically you have a mental health index. You get to understand what are the contributing factors generating depression and anxiety in your workers. You also get suggested actions and initiatives for your specific case, depending on the case, the aggregate mental health state and the contributing factors of your workers, of your people. And we also have support and workshops that we can also help you out with, that we can implement in your organization if you decide to go that way as well. So MindCheck is effective because it addresses the issues on both sides. It addresses the issues on the employee side in a very insightful and private manner, which is very important. And also addresses the issue in the organizational side, which will give you a lot more understanding of your current situation and what to do about it. So that's very like the strong point of MindCheck, and that's where MindCheck is very different than any other solution out there. So let me actually show you the system, how the system addresses the issue on both sides. So let's go to the actual system here. So MindCheck for organizations has the MindCheck for individuals experience built into it, as well as the MindCheck for organization reports and dashboards and so forth. What happens is MindCheck for organization allows the organization to create mental health campaigns. So if you go to the dashboard here, the organization can create a mental health campaign. There's two types of campaigns. There is the standard campaign and the ongoing campaign. And I will explain each one of those. So the standard campaign is almost like a survey that you do it periodically with your people. You can click here and create a campaign. You can create a standard and an ongoing campaign. Let's say if you've created a complete standard campaign. In the campaign, you go here to add the people that you want to include in that campaign. And it only needs basically names and emails, so we can send out an email out to the employee or to the people. And if you like, this is optional, you can just also classify them in 3 different groups. One can be the country, the second can be the department, and anything else that you want to classify them. That's basically only for filtering reports later. So once you have added people, and you can bulk upload via CSV or add one by one, whatever you want. So once you upload the names and emails of the people that you want to include in the campaign, you will go here and click Launch Campaign. We have already launched this demo campaign here, but once you click Launch Campaign, what the MindCheck system will do is that it will send an email, a private email to each one of your employees, and will tell them that your organization is running a mental health campaign via MindCheck, which is an independent organization, and that asking them to check their mental wellness via this link, this quick questionnaire. They can just click and take the questionnaire. And they will understand the levels of depression, anxiety, and stress, the contributing factors, the things in the lifestyle that is generating depression, anxiety, and stress, and what to do about those. Also, we will ensure that their individual results will never, ever be shared with the organization. That's very important, because that's a very intimate issue for the person. Mental health issues are very intimate. So this kind of ensures privacy and allows more and more people to take on the survey once we launch the campaign. So usually they go there, click on the link, take the survey, and once at least 10 people complete the MindCheck questionnaires, the two questionnaires, they are given one after the other. Once they complete the questionnaires, at least 10 people, the organization will have reports available here. But before going to the reports, let me just show you the experience of the people, of your employees or your people. It can be students, whatever public that you want to apply or to launch a MindCheck mental health campaign with. So once your employees or workers click on that link to take on the MindCheck questionnaires, they're directed to a very easy, mobile-friendly questionnaires. They can take it completely online and takes about 10 to 15 minutes to complete both questionnaires, about 7 minutes each. And it's very easy to complete. And they'll get to a results page like this one. They'll understand their personal levels of stress, of anxiety, and of depression in a 5-point scale. And this is using an industry standard depression, anxiety, and stress test. This is the same test that most doctors and psychologists and researchers use in countries such as Australia and a few other countries there as well. So it's an industry standard stress, depression, anxiety test. They will get their levels of stress, anxiety, depression, and also they will understand what in their lifestyle, what events in their lives are generating or potentially contributing to their states of depression, anxiety, and stress. So here are 12 contributing factors, and we'll be adding 3 more here because of new research has come out. So here are 12 evidence-based contributing factors that the people that take the MindCheck test can understand, can see which ones are probably affecting their mental health state. Once you click on one of them, you can come down here, you'll see how it affects. So we explain to the person here how it affects, how it is related to depression and anxiety. And they can click here, check the science, basically. We'll put links to academic papers and research and good sources. But also we tell the user what they can do about it. So if they rate high in loneliness, for example, we give them a few tips and initiatives that they can take, a few actions that they can take to improve on that condition, to reduce the impact of that contributing factors. And very soon, we are developing further features that will be launching very soon, in which we can actually give them resources here, such as videos, or recommend apps, or recommend online services. They can address these contributing factors straight from this page here. And this has been very well received by users. I mean, we have thousands of users taking these tests every day, and they all love it. We receive, if you go to the bottom here, you can see we have feedback that people might say like it, neutral, don't like it, and say why. And we receive many of those every single day of people loving it, saying that this has helped them so much, and they go out and seek help based on this language that we use here. And by the way, that's very important. The language, the whole idea of this questionnaire, of this results page, is that this will give users insight into the condition. Many people will come here, do the test, and say, hey, I really didn't know I had anxiety. I now know that this is treatable. I now know what to do to get rid of it, to get this treated, to get over this issue that I'm feeling. So this creates the insight, this creates the education that the user needs to take action around it. This gives them the understanding of what areas, of what contributing factors in their lifestyle and life events are generating or contributing to depression and anxiety, and what to do about those. So it's very powerful. This usually breaks barriers of seeking help, breaks the stigma in the user, and breaks barriers of seeking help. Everything is based on science. Everything is designed. The language is designed to break barriers and to encourage people to seek help. So that is the user experience. That's what your employees will feel or will see once they take the MindCheck test as well. Additionally, as you are an organization running a MindCheck campaign, you can put here at your organizational resources, you can put here links to your current mental health resources, things that you are already offering to your employees. Let's say, for example, you have a mental health policy, and you want your users to click here and understand what is your mental health policy. Let's say, for example, you have an EAP provider with counseling available for your employees. You would put it here as well to contact them and book sessions, book like counseling sessions for your employees, for people who are struggling with mental health issues there. Let's say, for example, you have a few employees who are mental health first aiders, and you can put basically a list of the names here, or a link for another page with the names of whatever resources that you have, so your employees will easily reach those resources just as they see the results, just that they get that leverage of understanding, of breaking barriers, and they will come here and address their issues basically with your resources, and also with these suggestions MindCheck gives them. So that's the MindCheck experience for the individuals. Going back here for the organization, once 10 or more people complete the assessment, gets that awareness, get that understanding, get that insight, and leverage to seek help, leverage to get better, the organization, you as a leader, can come here, go to view report, and we have two reports. They're very, very important. The first one is the organizational mental health condition report. This will tell you your mental health index, which is basically the percentage of your people, at least in this campaign, that are either normal or mild. They are kind of okay. They have no issues in depression, anxiety, or stress. So you can see here in this demo or sample organization here, we have 70% of the team, of all the people in this campaign that have completed the questionnaires. They are okay. They are mentally healthy, let's say, in terms of depression, anxiety, and stress. But also shows that about 30% have either moderate, severe, or extreme of either depression, anxiety, or stress. That's the highest level of any of these conditions. And you can see the breakdown here. How many people are having depression, anxiety, and stress, and you can understand the situation in your organization. But the coolest report is the next one, is the contributing factors report. This will tell you what areas you should focus on so you can address these issues. So in this report here, basically it will tell how many of your people in that survey, basically in that campaign, how many of your people are being affected by each contributing factor, by each science evidence-based contributing factor. So in this case here, this is a sample organization again. 90% of the respondents in this campaign are being affected by a loss of hope or insecure future. 65% are being affected by lack of sleep or exercise, and 63% by being separated from nature. So if you click here, you can see how many people are being affected, either high, medium, or low. And you can come here and expand. You can understand how this affects depression and anxiety. So we'll give it a kind of an explanation of how it is linked to depression and anxiety. You can check the science as well. You can see all the academic papers that we have linked here and the publications that are important for this contributing factor. And also you can see what to do about it. So these are a few ideas and suggestions on what to do about it. There are a few contributing factors that have more information. Let's say, for example, work issues. If you go here, there are several sub-issues, and you can check the details of those sub-issues there. And you see here the breakdown of the issues related to the contributing factor, work issues, for example. You see here lots of things that science has shown a causation effect, a correlation effect to depression and anxiety in the workplace. So we have things such as inappropriate workload, inappropriate job fit, inappropriate levels of control or autonomy, and so forth. There's several sub-issues that you can check and can see how many people are being affected by each of these sub-issues in this contributing factor. So here, again, work issues, you can understand how they are related to depression and anxiety, each one of those sub-issues as well, and also what to do about it. If there is workload issues, do this. If there is control and autonomy, these are a few things that you can implement as well. So these are basically ideas of initiatives that leadership of the organization, of HR, can implement to address each contributing factor, to hopefully improve on the organizational mental health KPI over time. So ideally, you would go and launch So ideally, you go and launch a standard mental health campaign with MindCheck every 3 or 6 months. So you can ask your users to do that check-in, to do that mental health check, basically understand their conditions, which can change over time as well. And you can get your mental health KPIs, you can check your contributing factors affecting the organization, and you can renew the initiatives and make sure they're working to improve the general mental health in your organization. The standard campaign is unique in which it is one survey in a point in time. The ongoing campaign is a little bit different. It's more of a resource that you can give to your employees to take the MindCheck test at any time and anywhere. So the ongoing campaign is very simple. It's basically a link or a QR code. This QR code is basically this link encoded in QR code. And you can use these in something like things like a poster like this that you can put into the common areas of the organization, such as the kitchen, lavatories, waiting rooms, or anywhere where your employees can kind of corridors that they can go around and see the poster. They can take their phones, just zap the QR code, take the MindCheck test very quickly, and get that understanding of their mental health condition and what to do about it. They can take this anytime, anywhere, and as many times as you want, as they want, basically, as many times as they want, and kind of use this as a resource, as a checking resource, self-checking resource to understand their situation there. This will give you basic statistics because basically people can take these anytime, as many times as they want. So this will give you how many people are completing this survey every week, and the maximum levels of depression, anxiety, stress of the people that are completing. The data here is very new because it's a new demo account, but they will show people doing this test every week. Many people doing every week as well. So the ongoing campaign is supposed to be used alongside the standard campaign. Ideally, you would launch a standard campaign, get that baseline, that KPI, get your users familiarized with the MindCheck questionnaires, and then you will just put an ongoing campaign as a resource to let your employees take it or your people take it anytime that they want. And later down the track, like in 6 months or 3 months, you launch a new campaign to make sure everyone completes the questionnaires and do that checking every so often, in a frequent manner. Then, again, even with the ongoing campaign, every time an employee completes the survey, the MindCheck tests, they will get access here they get reminded that you have resources that are applicable to them, and they can access those resources. So that is very important. So that's it about MindCheck. So it is basically you can create mental health campaigns for your organization in a completely private and frictionless manner. So your employees will not need to download any apps. And if they need to, we have seen that a lot of solutions are app-based, and most people don't download apps. It is kind of a block in the middle of the way. They just have to click a link and complete the MindCheck questionnaires. In their phones or computers, it's completely device agnostic. The MindCheck system works in any device just via click of a link. So it's very easy. It's basically frictionless. Frictionless is a word that we like to use a lot. And once you launch the campaign, it's basically frictionless. People go there, click the link, take the questionnaires, get the awareness, get the understanding, get the leverage for action, and you get all that important information around what are the contributing factors affecting the organization, and what I can do about it. What are the management initiatives that we can take to improve the mental health conditions in the organization there. So yeah, that's it. That's MindCheck for organization. That is the experience that your users and the portal administrator or your HR or your leadership team that will launch mental health campaigns, that is what they will do, and the information that they will get. So let's go back to our presentation here. So that's how MindCheck addresses the issues on the two sides, on the employee side and the organizational side. So there are a few extra screens here. And by the way, this presentation I can send to you, or we can send to you at any time, so you have all the details and you can remember what you have seen. Just let us know, we'll send to you. The next slides I will basically skim through, which is basically a lot of things that I have already explained. So for the employee, there is awareness, understanding, and personalized recommendations that they get. For the organization, also awareness, understanding, and personalized recommendation, but for management initiatives on what to do about the situation. And generally, because MindCheck is really focused on privacy, and we've developed the whole system with privacy in mind from the ground up. So, a few things, for example, we don't even record the name of a person next to the results. The results are only attached to the campaign. So we even ourselves cannot understand, cannot identify the results and link to a person. So we developed the whole system to be completely private for the individual. And this means, and we explain this, we properly communicate this to the employees, to the people taking the surveys, and this increases uptake a lot. We have seen mostly uptakes around 60 to 80%, sometimes even 90% of people in a campaign completing the survey and getting the experience there, getting their important awareness, understanding, and recommendations as well. So for the organizations, greater uptake generally means there is a lot more impact and better outcomes as well, which is what you would want. You want to address the issue of mental health in the organization. So you would want most people to self-check, to check with MindCheck and to address the situation if they need to. For user feedback, as I said, we receive these every single day, and it is heartwarming to see what people say about the system, how much they're helping them, and you can check a few of those on the website as well. And I'll leave these slides, I'll send it to you later, so you can refer to them. Basically, just explanation, a little bit more about explanation about the features that you have already seen, basically. We do work well with others. I mean, if you have an EAP providers, MindCheck is an awesome complement because it will generate the leverage for people to use them when they need it. Will generate the insight on the user, the awareness, and the kind of breaking of barriers, breaking of stigma for them to go there and use the EAP providers, which is what you would want if you want to solve the mental health issue in the organization. A few more information about compliance. Also, more information about privacy. We have a privacy policy that you can check on the website, and a few basic details here. A few of the awards that the MindCheck and the founders have received over their careers. Some benefits, just kind of a summary of benefits that we have already talked about. These are the founders. Some advisors, we have advisors from top universities worldwide, scientific advisors, like market advisors, company advisors. They'll help MindCheck to become awesome, or to become great. Also, a few partners. I mean, we have partnered with the World Health Organization, United Nations Development Program, specifically in the UMATER campaign in the country of Bahrain, in a public mental health campaign there. But we have partners all around the world that use MindCheck and that in their mental health initiatives, in their mental health services as well. And the most is very important as well that MindCheck is a registered social enterprise. So we are registered with Social Traders in Australia, which is kind of a body of certification for social enterprise. And we also registered with Queensland Social Enterprise Council. So this means that we measure our social impact and we direct a big amount of our profits to social impact. At least 50% of our profits will go back to social impact. And basically everything that MindCheck does generates social impact. MindCheck, the investment is very small. It's just $45 per employee per year. That's basically $3.75 per employee per month. We do a yearly contract generally, but we also have heavy discounts for volume. So if you have more than 20 or 50 employees, if you have thousands of employees, talk to us and we can do some custom pricing that I'm sure you'll be very happy with. And if you're interested, please get in touch. Or go to mindcheck.me and there is a form there to book a demo, or just send an email to hello@mindcheck.me, and we'll be happy to help, happy to talk a little bit more and get an understanding of your situation and how we can help you. So that's it. That's MindCheck organization, and thank you so much for listening. And I hope you have a great day there. Cheers.